I'm John Weber, and I'm a professor in the School of Pharmacy at Memorial University of Newfoundland and Labrador. I've been here for about a little over 15 years. I'm trained primarily as a pharmacologist, but also as a neuroscientist, so I've had my PhD for over 20 years now. My major emphasis of research is basically trying to find neuroprotective agents. So those would be compounds that are protecting the brain, primarily the brain and the nervous system, from things like just brain aging in general. So oxidative stress, I think a lot of people have heard about antioxidants, as well as things like neurodegenerative diseases, things like Alzheimer's and Parkinson's disease. There's also an aspect of that called neuroinflammation, where there's believed to be inflammation in the brain that contributes to these types of diseases, and just probably brain aging in general. So a lot of my focus in the past, say, 10 years has been on trying to find natural substances that can combat these types of diseases or disorders. So a lot of that work has been focused on berries, blueberries, lingonberries, which we call partridge berries here in Newfoundland, red berries up in Labrador, as well as marine products. So sea cucumber is one of the things I've been looking at for the past, say, 3 or 4 years to see if they have, or extracts from sea cucumbers have protective effects. Also, seal oil is something we were hoping to do work on and may do in the future. More recently, cannabinoids, so compounds from cannabis. We have some funding for that now to look at potential anti-inflammatory cannabinoids that could be useful for things like Parkinson's disease or brain aging, etc. In a way, it's almost reverse innovation because I'm trained as a pharmacologist, so a lot of the focus, in my training, I was always taught like drug discovery, like we have to discover new drugs to treat ailments. And of course, that's a lot of what pharmacologists do as scientists that try to do that. But there's also a lot of natural products that exist already that I think we just don't have enough knowledge of. So in a way, I say it's reverse innovation because in many ways, like for example, indigenous peoples have had this knowledge for centuries probably. What I've tried to do, at least in our approach, is look at natural remedies that maybe not like the only treatments for an ailment, something like that, but maybe preventative treatments, anything that could be good for the brain, as far as brain aging, things like neurodegenerative diseases. And that's what my focus has been on, these natural products. So that's what I think is innovative. Now we're kind of approaching looking for these natural remedies, but doing it in a more, say, modern scientific way. I'd be looking for collaborators, because I'm not a clinician, so often clinicians are needed to come on board. But any approaches, as well as like bench science, at finding out, potential protective effects of cannabinoids would be most welcome. But another project that I'm heavily involved with now is, obviously I'm a bench scientist primarily, so a lot of my work is now moving into patients, Parkinson's patients in general. So I do have some collaborators in that field. And we've done a lot of work in cell models and some animal models that show berries and sea cucumber extracts, for example, can be protective in these models. So obviously the next step would be to get to humans, to patients. I think that's the desire of even a basic scientist, is you want to see how your work is manifested in patients, in the health sciences, of course.